With consent to speak as if in morning business.
Without objection.
Madam President, I've come to the floor many times to, over the past several months, to outline the problems that we're facing with the rollout of the Obamacare law, the problems that my constituents are facing and people all across the country. And while it's important to discuss the generic and macro effects of this law, and we see it unrolling before us every day, it's also important to understand what the direct effects are to people at a personal level. Now, I traveled last week during our break time throughout Indiana and talked to a number of people. Many of them just came up to me voluntarily to tell me what the effect to them was over this confusing, complex, and seemingly intractable from an understanding standpoint of Obamacare. And so let me read just a couple, for the record, just a couple of the statements that were made to me. An email that I received from Daniel in Elkhart, Indiana, I think summarizes the experiences of literally hundreds of thousands of Hoosiers and millions of Americans that they're having with the website alone. He wrote, and I quote, "I have tried for 2 weeks to apply through the marketplace, only to electronically sign my application, but then it was kicked back to my profile page. This is the most bizarre system I have ever experienced. If a company put a business website together like this, they would be out of business." Anthony in Indianapolis shared similar concerns. He said, "I have been unable to get through the healthcare government website. My wife must notify our insurance company by November 15 if she will keep her existing plan. I understand there are problems with the website." I think we all understand that at this point. "I heard the president say you could sign up in person or on the phone or on paper, but the 2 navigators I called to help me through this said that until the website works, they can't help. I called the 1-800 number, but the healthcare.gov reps said his computer was frozen up and he could not give me any help. I hear about the tech surge, how there will be a few rough spots," another understatement, few rough spots, "and how they will be fixed. Senator, if you listen to the news, the problems with the system are much deeper than the president let on in his Tuesday address. I need help, and I don't think the system will be in operation in time for me to make an informed decision." These are 2 statements from only 2 of the many, many Hoosiers who have described similar problems to me, which is probably why, when asked about the Obamacare website, an experienced online and database programmer told CBS News, and I quote, "I would be ashamed and embarrassed if my organization delivered something like that." Now, we know that this law passed the Senate on Christmas Eve Day, 2009, without any bipartisan support. One party alone put this law into place. And we now know that over $400 million have been spent to create a website so Americans who are mandated to accept this Obamacare law can go and sign up for it. We know that nearly 4 years of notice has been in place to get just the website up. And this rollout, as one Democrat senator said over the weekend, has been a disaster. Now, if the administration, after 4 years of effort, nearly 4 years of effort, and over $400 million can't get the website right, how in the world can anyone believe that the federal government can manage this monstrous and dysfunctional law that has been imposed upon the American people? Now, despite the website's numerous glitches and many other implementation problems, despite this, the administration still insists on fining taxpayers if they don't sign up and purchase Obamacare under the compliant policies. What an irony. You need to sign up or you're going to get fined. but the website is so dysfunctional you can't sign up, but you're still going to get fined. That is mind-boggling, head-scratching, and simply unacceptable. Now, Madam President, we know that there's been numerous attempts to repeal this law, replace it with something far more acceptable, affordable, and implementable. We now know that the defund effort that resulted in the shutdown failed to gain the necessary votes to achieve that goal. But I think the responsible thing to do, and in September I introduced a bill to delay the rollout of the Obamacare mandates for a year. And as the problems with the health care law pile up, I'm going to continue to push for this delay. The delay makes sense because the program is simply dysfunctional and it's not going to be implemented. Bottom line, though, is I want this delay so that the American people have another chance to learn what is in this law, to evaluate as to whether or not they want this to go forward as the health care law of the United States, or whether they think a viable alternative that we have the responsibility to put forward, and many of us have advocated components of that, whether or not that alternative is the better way to go. Now, I know it's been said by the President and others that in 2012, the public went to the polls to vote for the presidential election. And therefore, that vote certified that the American people would support and wanted the Obamacare law. First of all, that wasn't the primary, it was one of the issues that was a determinative factor in the outcome of that election, but not nearly the factor. Because most Americans at that point still had not had the opportunity or the experience that they're having now in finding out exactly just how this law works and does not work, finding out all the dysfunction, and learning that all of those campaign promises made, or promises made when the law was passed, have simply been broken. You can keep the insurance policy that you have now, no problem. Won't cost a penny more, no problem. On and on it goes. Keep the doctor that you want. Americans are finding out that none of this is true. Premiums will not rise. Premiums are rising for many, many Americans. This will be easy. Go to a website, sign up, punch in, put your name in, you're on board, everything's great. None of this has worked. So why not delay this process? Not just to learn more about what's here, but to primarily give the American people another opportunity to vote with their feet, to walk into the polling booth, as this being the issue that they're voting on, and a number of members will have to stand up and either explain why they supported this, why they didn't support it. Americans will have a choice. We'll put alternatives in front of them. And so that's the purpose of the delay for a year. One, because it's dysfunctional. Two, because Americans deserve a second chance to express their opinions on this bill. This has already been passed by the House of Representatives. My colleague, Representative Todd Young of Indiana, sponsored that. It gained bipartisan support, 22 Democrats. House Democrats recognized the need to give Americans the same relief from Obamacare that businesses are receiving. So codifying the delay on the employer mandate, which the President has proposed and put into practice, and doing that for the individuals and families that don't fall under the employer category only is a matter of fairness. And that also is something that has to be addressed. Recently, several Senate Democrats have come out in support of delaying parts or all of the President's health care law as well. So I think the opportunity here is before us to put the brakes on trying to jam through something that simply is dysfunctional and not working. And secondly, to give the American people the opportunity to go back to the polls and decide whether or not this is the way they want their health care programs to go forward. We've had nothing but broken promises. We're learning about how difficult it is for the government to manage even the first step, let alone the 1/6 of the economy that deals with our health care. This is important for all Americans, and I'm urging my colleagues to support this effort to give the American people another chance to look at a more viable and a more affordable alternative. And with that, I yield the floor.
Madam President.